بسم الله الرحمن الرحيم. عندنا الشابتر الأول زين pre-operative management. Management, the safe conduct of anesthesia require meticulous pre-operative assessment. conduct يعني management، يعني استمرارية التخدير للمريض وسلامته، والمانجمنت يعني بشكل عام مالته يتطلب meticulous pre-operative assessment، يعني تقييم دقيق. preparation and planning، كذلك تحضير وخطة التخدير. مثلا in the case of elective procedure this should occur well in advance of surgery. In case of elective procedure this should occur well in advance of surgery, allowing comprehensive review, concurrent disease, medication and social issue. This is often carried out in dedicated pre-operative assessment clinic by multidisciplinary team comprising nurse, medical staff, as well as pharmacist and specialist technique. While patient undergo emergency surgery may not benefit from such structured approach to their pre-operative management, they must nevertheless undergo rigorous systemic review and preparation to ensure optimal care. عندنا pre-operative assessment screening. When elective surgery is first planned, screening questionnaire may be used to provide information regarding comorbidity that may require an early pre-operative review or intervention. A need for additional specialist input can be identified and acted upon at this stage. حلو. Pre-operative assessment clinic. During subsequent pre-operative assessment, general medical history is taken, detailing concurrent disease and its management. Correspondence in the clinical note may provide useful outline of disease process, giving some indication of its stability, as well as information on previous hospital admission, current medication, and recent investigation result. A history should be taken of a previous anesthetic experience. A family history of problem associated with anesthesia must be noted and may require further investigation. The patient يعني مثلا ممكن malignant hyperthermia عند واحد من الأهل صايرة في إحدى العمليات، سواء متفاديها صاير شيء، المهم أنت تسأله تحسس دوائي وهكذا. Patient general health should be assessed. General health, in particular a history of reflux should be noted, along with smoking, alcohol habit. History of recreational drug use may be appropriate. A list of current medication, include dose and recent change, is essential, along with history of any allergic or other adverse drug reactions. The nature of the allergy or reaction should be recorded. Okay. Particular attention must be paid to drug requiring specific pre-operative management, such as anticoagulant or insulin. هاي ذني مهمات. أكو علاجات مهمة تسأل عنها، ومهمة يعني تعالج أو تتخذ فيها إجراءات. General physical examination must be carried out prior to anesthesia and surgery. Of particular importance is a focused examination on cardiorespiratory system. حلو. This aims to ensure control of conditions such as hypertension, but also to detect such as a new cardiac murmur. The latter may require further investigation. A functional assessment is particularly important in patients with cardiorespiratory disease. This will be considered in more detail below. هسه راح يحكي لك عنها. Assessment of cervical spine should be made with patient with condition likely to limit neck movement. Radiological examination is seldom necessary, but limitation of movement should be defined as recorded. The presence of neurological symptom or signs will require further evaluation. Presence and location of any loose or damaged teeth should be noted, as well as denture, crown, and orthodontic appliances. أسنان تركيب شغلات أسنان مفقودة لازم نلاحظها. عمليات بالمفصل الفك وهكذا. Airway assessment is of fundamental importance and is generally carried out at the time of anesthetic preoperative visit. Preoperative assessment of functional capacity. Functional capacity, what a patient can physically do. Not only describe exercise tolerance, but give indication of functional reserve, extent to which that patient can can be physically challenged. This is particularly important in preoperative assessment of surgical patients with cardiac disease. A gross limitation or deterioration of functional capacity is particular significance and indicate the need for further assessment, include investigation and specialist opinion. When considered along with clinical, mainly cardiac, factor and plan surgical procedure, an estimate of functional capacity helps us to make assessment of perioperative risk. We can express functional capacity is so-called metabolic equivalent. Metabolic equivalent MET unit. هذا الفيجر هسه راح نشوفه. MET is expressed in terms of oxygen utilization and quantifies that estimate amount of energy expended at different level of physical activity. عندنا MET. 1 MET يساوي 3.5 مليلتر of oxygen per kilogram body weight per minute. خلينا نشوف بس تعريفه على السريع. الميت expressed term of oxygen utilization and quantifies the estimated amount of energy expended at different level of physical activity. الأكسجين اللي ينصرفه خلال بالكيلو الواحد خلال جهد معين. metabolic equivalent of كمان هذا مهم جدا الموضوع. يعني هو هذا الميت زين daily activity. 1 mate walk 100 meter on level ground. 4 mate climb a flight of stair or walk up a hill. أكثر من 10 strenuous exercise. فهذا يعني بشكل عام حاجي لك عنه. هسه تفاصيل جوا موجودة. حلو. الواحد يقدر يمشي 100 متر. الميت الواحد 1 mate 400 يصعد درجة أو يمشي على أطراف أصابعه، يصعد درج أوكي. أكثر من 10 يسوي تمارين قوية. Functional capacity corresponding to weight أقل من 4 unable to climb or flight a stair is associated with increased perioperative risk. A more detailed assessment can be made by referring to activity scales such as DOC Activity Status Index. The answer to series of questions related to daily activity provide a score related with functional capacity. Great care is needed in making such assessment, as function may be limited by factors such as arthritis, neurological disease. Okay, in such case, more specific symptoms such orthopnea or paroxysmal nocturnal dyspnea are helpful in identifying cardiac disease as the factor limiting functional capacity. Number of baseline investigation may be carried out at the time of preoperative assessment. These typically include full blood count, electrolyte, and ECG, pulmonary function. Okay, خلصت الجملة جديدة. Pulmonary function test may prove helpful in some patients with respiratory disease. There are, however, comprehensive guidelines available to minimize unnecessary investigation in fit young patients. Further investigation must be guided by underlying disease as functional status. Additional blood tests, for example, might be required to assess thyroid or liver function. In some cases, there may be need for radiological investigation, echocardio, and occasionally cardiopulmonary exercise tests. Such investigation should only be sought following discussion with experienced clinician. This investigation places a heavy demand on technician and may themselves carry a risk for the patient. The likely benefit must therefore be carried wide up. Some patients with serious comorbidity may be referred by preoperative assessment clinic at this stage for further assessment by senior anesthetist. Written information regarding anesthesia and specific surgical procedure is often provided to patient at this time. هسه عندنا preoperative visit. هسه راح يبدأ الحكي. خلينا نوصل للإيروي وناخذ استراحة. preoperative visit by anesthesiologist قصده يعني is essential and increasing occur on day of surgery. Such a visit provides opportunity for introduction, confirmation of medical condition, and explanation of the anesthetic rule. General medical and surgical history is often already available and can be discussed in further detail. Specific issues regarding previous anesthesia and associated problems are discussed. Earlier examination findings should be available following preoperative assessment. Examination of dentition and neck movement along with assessment of airway may be made up at this stage. A plan of care including proposed anesthetic technique, post-operative analgesia, and fluid management can be outlined to the patient. Discussion regarding the risk and benefit of proposed procedure is usually much appreciated. This also provides opportunity to discuss any concern the patient may have regarding specific issues such as post-operative nausea, vomiting, and duration of embolization, immobility following regional anesthesia. An effective pre-operative visit should do much to allay anxiety, leaving the patient well information and confident in those carry for him or her. It may well preclude the need of pre-medication. بس ناخد ريست لأن الموضوع الجاي مهم، الاير واي.